COVID-19 around the world. Why should you care?
LA County sees big drop in COVID hospitalizations.
The number of COVID-positive patients in Los Angeles County hospitals dropped by more than 200 people, falling from 3,233 to 3,012, continuing the downward trend of the last couple weeks, according to the latest state figures out Saturday. Of those patients, 616 were in intensive care, down from 652 on Friday. What you need to know. The rolling average daily rate of people testing positive for the virus continued to fall, reaching 6.9% as of Friday, down from 7.9% on Thursday. Figures showed that children between 5 and 11 still have the lowest vaccine rates, with just 32% having received one dose and 23% fully vaccinated. Public Health Director Barbara Ferrer said Friday that if the county wants to end the winter surge of COVID infections, we'll need to continue the common-sense protective measures that we know can slow COVID-19 transmission. Ferrer said the mask mandate will be dropped at outdoor mega events, and outdoors at schools and child care centers if COVID-positive hospitalizations in the county fall below 2,500 for 7 consecutive days. Some patients entered hospitals for other reasons and only discovered they had COVID after a hospital-mandated test. The latest numbers came as local health officials reported another 84 deaths associated with the coronavirus and 9,997 new positive COVID-19 tests, bringing the county's totals to 2,720,216 cases and 29,364 deaths since the pandemic began. Saturday's case numbers may reflect a lag in weekend reporting. Public Health Director Barbara Ferrer said Friday that if the county wants to end the winter surge of COVID infections, we'll need to continue the common-sense protective measures that we know can slow COVID-19 transmission.
Anti-vaccine mandate protests spread in Canada.
Canadian cities, including the financial hub Toronto, faced disruptions on Saturday as protests against vaccine mandates spread from the capital of Ottawa, raising fears of clashes with counter-protesters. The so-called Freedom Convoy began as a movement against a vaccine requirement for cross-border truckers, but has turned into a rallying point against public health measures and Prime Minister Justin Trudeau's government. We're all sick and tired of the mandates, of the intimidation, of living in one big prison, said Robert, a Toronto protester who did not give his last name. We just want to go back to normal without having to take into our veins the poison which they call vaccines. Protesters have shut down downtown Ottawa for the past 8 days, with some participants waving Confederate or Nazi flags and some saying they wanted to dissolve Canada's government. The well-organized blockade, which police say has relied partly on funding from sympathizers in the United States, saw protesters bring in portable saunas on Saturday to combat frigid temperatures. One man rode through the area on horseback, carrying a Trump flag, social media videos showed. The former U.S. president has spoken out in support of the truckers against the harsh policies of far-left lunatic Justin Trudeau, who has destroyed Canada with insane COVID mandates. GoFundMe took down the Freedom Convoy's donation page on Friday, saying it violated the platform's terms of service due to unlawful activity. The group had raised about 10.1 million Canadian dollars. In a confusingly worded statement, the website said it would give refunds to those who request it by February 19 and work with organizers to distribute the rest to verified charities. On Saturday, GoFundMe said it would refund all donations automatically, but not before Tesla CEO Elon Musk called the company professional thieves.
South African company produces COVID vaccine using Moderna data.
South African biotechnology company Afrigen Biologics has used publicly available data on Moderna's mRNA vaccine to produce a vaccine of its own at a Cape Town facility. The vaccine could be tested in humans by the end of the year, Afrigen's managing director told Reuters. The reproduction of a widely used vaccine without the vaccine developer's assistance and approval is considered to be a world first, per the Wire service. We haven't copied Moderna, we've developed our own processes because Moderna didn't give us any technology, Petro Terblanche told Reuters. We started with the Moderna sequence because that gives, in our view, the best starting material. But this is not Moderna's vaccine, it is the Afrigen mRNA hub vaccine. Afrigen Biologics collaborated with the World Health Organization, to produce the vaccine using Moderna's vaccine data, gaining information on the lipid nanoparticle that carries messenger RNA into cells, and the mRNA sequence that instructs cells to produce the spike protein of the coronavirus in order to train the immune system to fight the virus in case of infection, Politico first reported on Wednesday. The first doses of the vaccine have already been produced and the company is conducting analytical work on a trial run, with more trials expected in the future to prove the safety and efficacy of the vaccine, according to Politico. This comes after the WHO last year announced that it was working with a South African consortium, including AfriGen, to establish a technology transfer hub with the goal of scaling up production and access to COVID vaccines by making the technology behind them available to companies around the world. The WHO and other organizations have worked to close a vaccination gap between wealthier nations and developing ones.
COVID-19 vaccines for kids under 5. What's coming next?
Former FDA Commissioner Dr. Stephen Hahn argues despite the Omicron being more transmissible than other variants, it's encouraging to see the COVID-19 booster protect against the disease. Parents who thought their children under 5 would have to wait several more months for COVID-19 vaccinations instead just might get them as early as March. Here's what needs to happen first, and some things to expect if they do become available in the US. Pfizer has asked the Food and Drug Administration to authorize extra-low doses of its COVID-19 vaccine for children ages 6 months through 4 years. The FDA will review the application and convene a panel of outside advisors in mid-February to debate the data. The FDA will use that advice in deciding whether the new doses are safe and effective enough for the youngest children. CVS removes COVID-19 test purchasing limits. But that's not the last step. The Centers for Disease Control and Prevention will gather its own expert panel to help decide if the shots should be recommended for this age group, and if so, for all of them or only those at higher risk from COVID-19. A healthcare worker prepares a dose of the Pfizer-BioNTech COVID-19 vaccine at an Oklahoma County Health Department vaccine clinic in Oklahoma City, Oklahoma, U.S., on Wednesday, November 17, 2021. Nick Oxford/Bloomberg via Getty Images. Special shots for children in this age group are 1/10 the size of the adult doses. That's even smaller than the doses given for 5 to 11-year-olds, which are 1/3 the dose. Pfizer will have to specially bottle the extra-low doses so vaccine providers don't mix them up with the 2 other dosages already being used. 2 doses or 3? Here's where this gets complicated. In December, Pfizer announced a setback. Preliminary study results showed 2 of the extra-low doses appeared strong enough to protect babies but weren't strong enough for 2 to 4-year-olds.
U.S. coronavirus deaths surpass 900,000. Driven in part by Omicron surge.
The coronavirus pandemic reached a grim new milestone in the United States on Friday with the nation's cumulative death toll from COVID-19 surpassing 900,000, even as the daily number of lives lost has begun to level off, according to data collected by Reuters. The latest tally marks an increase of more than 100,000 U.S. COVID-19 fatalities since December 12, coinciding with a surge of infections and hospitalizations driven by the highly contagious Omicron variant of the virus. Preliminary evidence has shown that Omicron, while far more infectious, generally causes less severe illness than earlier iterations of the virus, such as Delta. But the sheer volume of Omicron cases fueled a surge in hospitalizations that has strained many U.S. healthcare systems to their limits in recent weeks. Experts have said the bulk of Omicron patients requiring hospitalization were unvaccinated individuals and people with other underlying chronic health conditions. Data also suggests that Omicron may have hit the United States harder than other countries with younger overall populations, such as in Africa. As of Friday, according to Reuters' running tally of state-reported data, the total number of American lives lost to COVID-19 since the first U.S. cases were detected in early 2020 has reached at least 904,228, more than the entire population of South Dakota. U.S. President Joe Biden, whose first year in office has been dogged by a pandemic that has proven more implacable than was expected, due in part to many Americans' hesitancy to get vaccinated, used the occasion to urge greater vaccine uptake. Some 250 million Americans have received at least 1 shot, and we have saved more than 1 million American lives as a result, he said in a statement.
COVID hospitalizations starting to fall in Alabama as Omicron fades.
COVID-19 hospitalizations are finally starting to fall in Alabama, as Omicron cases and positivity rates have declined throughout most of the state. But hospitals are still facing a tough challenge, according to state health experts. While inpatient hospitalizations are clearly trending in the right direction, ICUs are still a problem, said Dr. Donald Williamson, president of the Alabama Hospital Association. The Alabama Department of Public Health reported there were 2,540 COVID patients in Alabama hospitals as of Friday afternoon. That was down from 2,961 on January 25, a number that surpassed the high during the Delta wave but didn't quite reach the 3,000-plus hospitalizations seen during the winter surge of 2021. Hospitalizations, based on the trend, clearly seem to be improving, Williamson said. But data from the Alabama Hospital Association shows there were still more than 500 COVID patients in the ICU statewide, and nearly 300 on ventilators, numbers that haven't improved much even as cases and now hospitalizations have started to decline. And Williamson noted that there were just 89 ICU beds available statewide as of Thursday. While cases are coming down, we're not seeing much change in ventilator use or ICU use, he said. It just reinforces that people who end up in the ICU and end up on ventilators are going to be there for a while. Hospital Association data shows that vaccines, and particularly boosters, remain effective at preventing hospitalization. Williamson said less than 5% of inpatients had received a booster dose, a number that's remained steady throughout the Omicron surge. Alabama's vaccination rate remains low compared to the rest of the nation. The state is once again last in the United States in vaccination rate, with just 49.5% of the total population fully vaccinated.
Fort Bragg soldiers affected by directive to separate soldiers refusing COVID vaccine.
The Army will immediately start separating soldiers who refuse the COVID-19 vaccine, it announced this week. Commanders are to begin involuntary separation proceedings against soldiers who refuse the COVID-19 vaccination order and who do not have an approved or pending exemption, an Army news release said Wednesday. Army readiness depends on soldiers who are prepared to train, deploy, fight and win our nation's wars, Secretary of the Army Christine Wormuth said in the release. Unvaccinated soldiers present risk to the force and jeopardize readiness. We will begin involuntary separation proceedings for soldiers who refuse the vaccine order and are not pending a final decision on an exemption. A spokesman for the 18th Airborne Corps and Fort Bragg estimated that more than 97% of soldiers here were vaccinated as of Wednesday. Fort Bragg is America's most populated military installation with about 55,000 service members. According to the Department of Defense's latest data Wednesday, 597,533 regular Army, National Guard and Reserve soldiers have received the COVID-19 vaccine, and 276,240 are partially vaccinated with at least one dose. As of January 26, an estimated 96% of regular Army soldiers and 79% of reservists were vaccinated. Army leaders gave regular soldiers a deadline of December 15, 2021, and reservists and National Guard soldiers until June 30 to receive the vaccine. According to the Army's news release, it has not yet separated any soldiers solely for refusing the lawful order to receive the COVID-19 vaccine. As of January 26, Army commanders had relieved 6 regular Army leaders, including 2 battalion commanders, and issued 3,073 general officer written reprimands to soldiers refusing the vaccination order. It's not known if any of those soldiers are from Fort Bragg.
New antibody developed by Chinese researchers may neutralize Omicron.
A team of researchers in China have developed a new type of antibody that could neutralize Omicron and future COVID variants. According to the team at Fudan University in Shanghai, the new antibody is a surprise discovery, made while researchers were investigating another disease, the South China Morning Post reported. This antibody will put humans a step ahead in the race against the pandemic, lead scientist Professor Huang Jinghe from Fudan was quoted as saying. The new antibody was synthesized from components of 2 different antibodies produced by human immune cells. While in their natural forms, these antibodies were futile against the Omicron, the man-made version breached the highly contagious variant's line of defense, Jinghe said, in the paper posted on preprint and not peer-reviewed yet. Jinghe's team along with collaborators at the National Clinical Research Center for Respiratory Disease in Guangzhou developed 8 different highly potent antibodies in a short period of time using this new approach, the report said. There are very few antibodies that can neutralize Omicron in the world. I feel like I've been hit by God's grace, she said, but stitching different types of natural antibodies together was not easy and the team tried various combinations. The components, despite being from different natural antibodies, have collaborative roles in the neutralization process, Jing has said. The team tested these antibodies against a live Omicron variant with a new mutation to evade immune attack, and found they worked just as well. The bispecific antibodies can also neutralize earlier strains including Delta, severe acute respiratory syndrome, a distant deadly relative of the current strain that emerged but disappeared quickly in 2003, and even some coronaviruses carried by bats, the report said.
Omicron plummets, New York leaders fumble.
There's good news, and then there's great news. COVID cases are down more than 90% from the first week of January. Hospitalization rates are down, too. The trend lines are all excellent, with New York State's overall test positivity rate down to 4.4% from its recent high of 23%. Omicron is plainly on the way out, as fast as we said it would go. Governor Kathy Hochul agrees. Just like the snow is melting, she said Tuesday, hopefully these numbers will continue to melt away. Will the increased restrictions she and Mayor Eric Adams put in place also melt away? Omicron prompted or accelerated policy shifts on the way up the curve, the mask-or-vax mandate, for example, from Hochul, and then Mayor Bill de Blasio's private sector employee vaccine mandate. It has not yet prompted a similar rethink on the way down. City and state policy on COVID has been, mostly, a one-way ratchet. It's time for a change. Hochul is hinting she might agree, at least on masks. Omicron is milder and quicker to spread. No shock there, viruses tend to evolve to be less harmful over time. Killing the host doesn't optimize survival. So future strains are likely to do even less damage than Omicron. Just as we've lived for a century with the far less deadly descendants of the 1918 Spanish flu virus, the last true global pandemic, we are going to be living permanently with increasingly weak, increasingly widespread variations of COVID. We need to accept this and get back to our pre-COVID lives. Adams stood up to fearmongers in the Department of Education and elsewhere and revamped COVID school policies in a way that actually made sense for kids and kept schools open through the surge. No harm, and lots of good, done. We need more moves like that from him and Hochul alike.
Omicron, T-cells and the science of why we need to update our COVID vaccines.
New studies suggest that it may be less rewarding to vaccinate individuals with vaccines based on the original virus spike protein. There may also be an additional risk of non-updated vaccines generating a suboptimal immune response against the Omicron variant. The Omicron variant hasn't only eroded our antibodies, but has also dented our T-cell immunity. The rise of SARS-CoV-2 variants and evidence of immunological interference underscore the need for preemptive, next-generation vaccines. What is common to Denmark, Israel, Austria, France, Switzerland, the UK, and the US? They all suffered an unprecedentedly severe wave of the Omicron variant despite having some of the highest vaccination rates in the world. Most of these countries have already boosted significant sections of their population with a third dose of a COVID-19 vaccine as well. Israel and Denmark have also been administering a fourth dose to some of their most vulnerable population groups. Israel also has a remarkably high level of the virus in circulation, resulting in by far the highest number of cases per capita during its Omicron wave, and set a 7-day new case record of 11,000 per million people. The frequent boosting strategy. Most approved COVID-19 vaccines are based on the spike protein of SARS-CoV-2, the novel coronavirus. They have worked reasonably well so far. But the advent of the Omicron variant, one of the most mutated strains of the SARS-CoV-2, has exposed the limitations of these vaccines, particularly their reduced ability to prevent infections and the onward transmission of the virus. For this reason, many countries and regions have rushed to grant booster doses.
The world is likely sicker than it has been in 100 years.
The world is living through a unique moment. In the past 5 or 6 weeks, the Omicron coronavirus variant has likely gotten more people sick than any similar period since the 1918 to 1919 flu pandemic, according to global health experts. While Omicron infections have peaked in many places, February is likely to see similar case loads as the variant continues to spread before it flames out, causing worker shortages from hospitals to factories and spurring debate about COVID-19 restrictions, particularly since Omicron appears to be causing less serious illness. In England, more than 1 in 6 residents are estimated to have caught the coronavirus since Omicron emerged in late November, surveys and modeling by the Office for National Statistics indicate. In Denmark, about 1 in 5 have caught the virus, and in Israel 1 in 9, authorities estimate. This is an unbelievably unique moment when so many people get infected by a pathogen at the same time, said Christopher Murray, the director of the University of Washington's Institute for Health Metrics and Evaluation, which tracks global health. Roughly 1 in 5 Americans had contracted Omicron by the mid-January peak, a number that could double by the time the surge ends in mid-February, Trevor Bedford, a virologist at the Fred Hutchinson Cancer Research Center, estimated. Having 40% of the population infected by a single pathogen in the span of 8 weeks is remarkable, and I can't think of an obvious modern precedent.
Corona Omicron February 6th highlights. Single-dose Sputnik Light COVID vaccine gets DCGI nod for emergency use in India.
Coronavirus Omicron cases and deaths in India live. COVID-19 booster shot vaccine registration latest update. Coronavirus third wave in India news February 6 highlights. Full office attendance for all central government employees from Monday. Delhi records 1,410 fresh infections. Positivity rate dips to 2.45%. Kerala reports below 30,000 new COVID-19 cases. COVID-19 India live news, new Omicron variant cases in India, coronavirus vaccine statistics and registration latest updates, February 6 highlights, India on Sunday added 107,474 new coronavirus cases, as per Health Ministry's updates. These new cases have taken the total COVID-19 infection tally in India to 421,88,138 cases. India recorded 865 deaths on Saturday, taking the death toll to 501,979 as per the data updated at 8 a.m. The Union Health Ministry data showed that the active cases have declined to 12,25,011. India COVID-19 status in last 24 hours, new COVID cases, 107,474, death recorded, 865, recoveries registered, 106,637, active cases, 12,25,011. India's Omicron-led third wave is seeing a slight improvement in certain pockets, the Narendra Modi government recently said. In terms of daily COVID cases, yes, the situation may have marginally improved. Till 10 days back, states such as Karnataka, Tamil Nadu, Gujarat and Maharashtra were witnessing massive coronavirus surge. But that trend has improved drastically now, official data shows. However, Mizoram and Kerala are still in the red zone. But the biggest aspect of the Omicron third wave in India is the silent surge in daily COVID deaths in the country. On Friday, India marked a grim record of over 5 lakh coronavirus deaths in the world. The US and Brazil are only 2 other countries that have seen such a staggering numbers of fatalities.
South Carolina coronavirus live updates, 4,000 new COVID cases.
South Carolina reported over 4,000 COVID-19 cases and 23 coronavirus-related deaths on February 4th, as the Omicron variant spreads. Just over 53% of eligible residents are vaccinated. We're tracking the most up-to-date information about the coronavirus and vaccines in South Carolina. Check back for updates. More than 4,000 new COVID-19 cases reported in South Carolina. At least 1.1 million coronavirus cases have been reported in South Carolina, and at least 13,527 people have died of the virus since March 2020, according to state health officials. The SC Department of Health and Environmental Control on Friday, February 4th, reported 4,231 new COVID-19 cases and 23 coronavirus-related deaths. There were also 1,778 probable cases and 24 probable deaths. The Omicron variant accounted for 99.7% of coronavirus strains identified in South Carolina during the week ending January 22, data shows. At least 2,250 people in the state were hospitalized with COVID-19 as of February 3, including 434 patients being treated in intensive care units and 225 on ventilators. Data shows nearly 24% of hospitalizations in South Carolina are coronavirus-related. As of February 4, roughly 20% of COVID-19 tests were reported positive. The Centers for Disease Control and Prevention has said 5% or lower means there is a low level of community spread. Just over 53% of South Carolinians eligible to receive a coronavirus vaccine are fully vaccinated, and about 62% have received at least one dose, health officials say.
New Jersey reports 80 COVID deaths, 2,582 new cases as Omicron wave continues descent.
The state on Saturday reported an additional 80 confirmed deaths from COVID-19, along with another 2,582 new cases. The 7-day average for positive tests now stands at 2,774, a 56% decline over the last week. That is the lowest mark for the 7-day average since December 3rd. The mark has dropped by about 90% over the last month. The 7-day average hit its peak on January 10 at 27,914, while the most positive tests in a single day was 33,459 on January 7. Hospitalizations from confirmed or suspected cases of COVID-19 dropped to 2,256, about 150 fewer than Friday. That's down 63% from January 11, when hospitalizations peaked at 6,089 patients. Trends show that the Omicron tsunami, as fast as it washed in, is washing out at nearly the same speed, Governor Phil Murphy said on Wednesday, while adding that officials are not yet totally comfortable with where the state is at and said they have to remain on vigilant footing. The statewide transmission rate for NJ has been 0.55 for 7 consecutive days as of Saturday. A transmission rate below 1 indicates the outbreak is declining with each new case leading to fewer than one additional case. A rate of 1 means the outbreak has leveled off. Saturday appeared to represent a drop in fatalities as well. Saturday is the first day of the month to have fewer than 100 deaths due to COVID-19, though officials caution that the daily reports do not include deaths from the most recent 24 hours and the numbers are sometimes delayed by days or weeks. About 6.64 million of the 8.46 million people eligible for the vaccine in New Jersey have received the initial vaccination, with 7.59 million having received at least one dose. New Jersey has now recorded about 1.84 million total cases of COVID-19 since the beginning of the pandemic, along with 29,029 confirmed deaths.
COVID-19 Omicron outbreak, 208 cases as numbers dip from Saturday's peak.
There are 208 COVID-19 cases today, a dip on yesterday's 243 cases, a record number of infections. Video/NZ Herald. There are 208 COVID-19 cases which have been reported in the community, a dip on yesterday's record number of infections. The new cases are across Northland, Auckland, Waikato, Lakes, Bay of Plenty, Hawke's Bay, Wellington, Nelson Marlborough and South Canterbury. One of the new cases in Marlborough was staying at the Tahuna Beach Holiday Park, but its source is currently a mystery. 12 people are receiving hospital care across Auckland, Waikato, Rotorua and Christchurch. One person is in an intensive care unit in Rotorua. 19 new cases have been identified at the border among recent returnees. There are 7 new cases in Northland and 1 in Nelson Marlborough were reported after the ministry's cut-off time, and will be added to case numbers later. There were 48,947 booster doses administered yesterday, lower than the record daily high on Friday. Almost 5,000 pediatric doses were given out yesterday. There were 16,873 tests carried out in the last 24 hours, almost 8,000 in Auckland. There are 14 new cases in Northland today, 7 are being reported in today's numbers, and 7 more that were notified after ministry's cut-off time and will be added later. 6 of these cases are in Kerikeri, 1 in Hokianga North, and 2 in Whangarei. All these cases are linked to previously reported cases. The remaining 5 cases are under investigation. In Auckland, there are 128 cases. More than 2,000 people are self-isolating at home, including 861 cases. Of 49 new cases in Hamilton, 23 are linked to other cases, and the rest are under investigation. 20 have been reported in Hamilton, 2 in Ohapo, 1 in Cambridge, 1 in Huntley, 1 in Matamata, 1 in Walton, and the remaining with locations under investigation, the ministry said. One new case in Rotorua is linked to a previously reported case.
Omicron sparks European health staff shortages, but spares ICUs.
Footage of overwhelmed doctors treating patients in makeshift conditions in Italy's Lombardy region in March 2020 was the first sign of the deadly threat posed by coronavirus in Europe. The sight of clinicians struggling to find beds in Spain's capital, Madrid, also foreshadowed the public health emergency ahead. 2 years on, the situation has been transformed in both regions with vastly reduced hospital admission thanks to vaccine rollouts and the disease's evolution into the milder Omicron variant. However, public health systems face different pressures. Health workers are contending with a big backlog of care postponed during earlier waves, a challenge compounded by staff absences caused by the highly infectious variant. As doctors and nurses are forced to self-isolate, absence levels of up to 20% are being reported in hospitals across Europe, said Maurizio Ciccone, an intensive care doctor in Lombardy who is president of the European Society of Intensive Care Medicine. That's a huge number which basically is creating pressure on this system, even if the number of patients is more manageable, he said. Ciccone said hospitals faced a massive backlog of treatments that has built up over the past 2 years. During the peak of the Omicron wave, routine surgery in Italy had fallen by up to 80% in some hospitals, he said. This is one of the reasons the narrative about COVID deaths or COVID hospitalization is missing a large part of the healthcare crisis, he added. The situation, he said, underlined the crucial role of vaccination in keeping people out of hospital. Every bed occupied by a patient due to COVID pneumonia takes away resources for other elective procedures.
U.S. death toll from COVID-19 hits 900,000, sped by Omicron.
Propelled in part by the wildly contagious Omicron variant, the U.S. death toll from COVID-19 hit 900,000 on Friday, less than 2 months after eclipsing 800,000. The 2-year total, as compiled by Johns Hopkins University, is greater than the population of Indianapolis, San Francisco, or Charlotte, North Carolina. The milestone comes more than 13 months into a vaccination drive that has been beset by misinformation and political and legal strife, though the shots have proved safe and highly effective at preventing serious illness and death. It is an astronomically high number. If you had told most Americans 2 years ago as this pandemic was getting going that 900,000 Americans would die over the next few years, I think most people would not have believed it, said Dr. Ashish K. Jha, Dean of the Brown University School of Public Health. He lamented that most of the deaths happened after the vaccine gained authorization. We got the medical science right. We failed on the social science. We failed on how to help people get vaccinated, to combat disinformation, to not politicize this, Jha said. Those are the places where we have failed as America. President Joe Biden lamented the milestone in a statement Friday night, saying, "After nearly 2 years, I know that the emotional, physical, and psychological weight of this pandemic has been incredibly difficult to bear." He again urged Americans to get vaccinations and booster shots. 250 million Americans have stepped up to protect themselves, their families, and their communities by getting at least one shot, and we have saved more than 1 million American lives as a result, Biden said. Just 64% of the population is fully vaccinated, or about 212 million Americans, according to the Centers for Disease Control and Prevention. Nor is COVID-19 finished with the United States. Jha said the U.S. could reach 1 million deaths by April.
Team USA bobsledder Alana Myers-Taylor to compete in Winter Olympics after COVID-19.
Team USA bobsledder Alana Myers-Taylor has been cleared to compete in the 2022 Beijing Winter Olympics after testing positive for COVID-19 last weekend. Myers-Taylor appeared live on Weekend Today, revealing that she was finishing up her stay in an isolation hotel after testing negative for COVID-19 twice. Now, the bobsledder will move to another hotel where she will continue her training. Myers-Taylor expressed that she was eager to begin preparing for her Olympic race, which is coming up in a week. Luckily, her friends and coaches have been keeping her in the loop. "They've been sending me notes on the track and doing different things like that," she said of her friends. "I also have tons and tons of video from our coaches who've just been doing everything they can to keep me engaged and keep me involved. So I've just been going over that as much as I can and watching video and doing whatever I can to stay ready." The Team USA athlete has been open about the inspiration behind her drive to compete in these Winter Games. Her son, Nico, who will turn 2 later this month. "I just want to show him that you can face obstacles and have challenges and overcome them and go after your goals," she said on Today. "This Games has turned out to be one of the most challenging ones I've ever competed at, and I just want to show him that his mother never gave up." Myers-Taylor revealed in an Instagram post on January 31 that she had tested positive for COVID-19 on January 29, 2 days after arriving in Beijing. Since then, she's been in isolation, which left her unable to represent Team USA as a flag bearer in the opening ceremony. While in isolation, Myers-Taylor made do with what she had to continue her workout regime and stay in shape for her events. She shared some of her workouts from her hotel room, showing how she made the best use out of the small space with the equipment she was able to procure, including a barbell.
Truckers continue vaccine mandate protest in Canada.
Canada's capital remains paralyzed for the second straight weekend by a trucker protest. The truckers have blocked the streets of Ottawa with their big rigs to protest the country's COVID-19 mandates. While the noisy protest has been largely peaceful, police are stepping up personnel with the rise in violent threats. The protests continued all day long and at all hours of the night. Those with the so-called Freedom Convoy say they're staying out until vaccine mandates are dropped, the masks come off, and life returns to the way it was. This whole event has gone beyond just vaccines and it is now about the entire ordeal, protester James McDonald said. "We're asking for freedom, that's all we want," another protester said. The protesters have been free to park big rigs next to the Prime Minister's office and to set up camp in front of the country's national parliament. As frustrated as the protesters are, Ottawa residents say they feel like hostages and want police to do more. "I understand the police force does not want to directly intervene for fear of violence, but it feels like we've been left alone a little bit," resident Jack Krentz said. One woman was so desperate, she tried to appeal directly to the protesters. "The downtown residents, children, elderly are suffering," she said. Protesters seem to hear her, but they're not listening. "This is nothing but disruptive, they're claiming their freedom and yet I can't ever hear anything, I can't even, hear anything myself," another resident said. Ottawa police say they have learned much in the past week, especially after reports of assaults, intimidation and allegations of hate symbols and speech. "Our goal is to end the demonstration," Ottawa Police Chief Peter Slowly said. To try and do that, they have called in more reinforcements, moving to what they call a surge and contain strategy.
Contra Costa County drops proof of vaccination. Negative test requirement at restaurants, gyms.
Health officials in Contra Costa County announced Friday certain businesses, including restaurants and gyms, are no longer required to check patrons for proof of vaccination or a negative test. "We believe now is the right time to loosen a requirement that made a lot of sense last summer, when a different variant of COVID-19 was dominant and there was less community immunity," Dr. Oritzvili, the county's acting health officer, said in a statement. Contra Costa Health Services said it was loosening the requirement after the county reached a full vaccination rate of 80%. Officials also said the Omicron surge has likely peaked and that hospitalizations have already started to decline. While cases appear to be declining, Zvili continued to urge caution. "But by no means are we back to normal. There are still many more cases of COVID-19 in our community now than there were in mid-December, so we need to continue to take precautions when we go out," he said. The order, which went into effect in September, required restaurants, bars, entertainment venues and indoor fitness facilities to verify customers were fully vaccinated or had tested negative within the past 3 days. Officials also required employees in indoor areas of the impacted businesses to show proof of vaccination or test weekly. Similar requirements were put in place in San Francisco and Berkeley. I would say the vaccine is the most important thing you can do to protect yourself, to protect your family, protect your community, Dr. Tzvili told KPX on Friday. People dining in Walnut Creek Friday had not learned about the change yet. Some were hesitant to dispense with vaccine verification. I think it's very surprising, I'm going to be honest, very surprising to me that they're doing that, said Peyton Reel, a Moraga resident.
COVID-19 vaccines may affect your menstrual cycle in this small, temporary way.
After months of cycling through anecdotal claims that COVID-19 vaccines may be affecting menstrual cycles and calls for more studies, you may be yearning for some real scientific evidence. Well, there's finally a real scientific study that's really been published in a real medical journal, Obstetrics and Gynecology. And, yes, the study did find that COVID-19 vaccination could potentially result in some changes to your menstrual cycle. However, before you put a period at the end of that sentence and jump to conclusions, note that the changes are likely to be relatively small and temporary, based on the study results. The study used natural cycles to track the menstrual cycles of 3,959 study participants for 6 consecutive cycles. Now, natural cycles may sound like a bicycle made out of leaves, but is actually a U.S. Food and Drug Administration approved female fertility app. Each of the study participants fell into one of 2 groups for comparison, either a vaccinated group or an unvaccinated group. For the 2,403 participants in the vaccinated group, the 6 consecutive cycles consisted of the 3 consecutive cycles right before they're getting COVID-19 vaccine doses, and then the 3 consecutive cycles immediately after vaccination. Of these folks who got vaccinated, 55% ended up receiving the Pfizer-BioNTech vaccine, 35% the Moderna one, and 7% the Johnson & Johnson/Janssen. For the remaining 1,556 in the unvaccinated group, the study simply followed them through 6 consecutive cycles.
No deal between Boston unions on coronavirus vaccine mandate after 9-hour session.
A marathon bargaining session that stretched into the night and included a proposal from the Wu administration to make the coronavirus vaccine mandate more flexible did not lead to a deal, as a court ruling looms and the city is ready to move forward on enforcement of the current policy. Mayor Michelle Wu's staffers and public safety union leaders haggled in the Parkman House from noon Friday until after 9 p.m. over the city's vaccine mandate. Our administration has invested significant time and resources in good faith bargaining to address unions' concerns about the impacts of a vaccination requirement policy, Wu said in a statement Saturday night, saying that the city could not reach an agreement with the union leaders. It's unfortunate that partners and leaders I respect continue to refuse responsibility for members to get vaccinated during this pandemic. We are ready to move forward with a full vaccination policy that aligns with public health goals, legal precedent, and state requirements. A bit after the halfway point of the negotiations Friday, the Herald got a hold of a draft of an offer from the city that was circling among first responders. The Wu administration was offering to tie the mandate to the severity of the pandemic during a given week, with the hard everyone must have a jab mandate only applying during virus surges. When the disease ebbed, based generally on measurements of the positive test rate, daily hospitalizations and ICU capacity, city workers who didn't have the shots would be placed on unpaid leave or use vacation days until the numbers came back down. The agreement also would have contained provisions that all new hires would have to get the vax, and that the unions would have agreed not to file grievances around enforcement of the mandate. But the city and labor leaders ultimately couldn't settle on a final agreement.
How worried do you need to be about the BA.2 coronavirus variant?
Cases of COVID-19 appear to be finally trending downward, but a new variant called BA.2, and nicknamed the stealth variant, has experts on alert. This new coronavirus variant appears to be closely related to Omicron, which is also called BA.1. The original Omicron is dramatically different than anything else before it, so we're not talking about the shift between Delta and Omicron, Dirk Dittmer, professor in the Department of Microbiology and Immunology at the University of North Carolina School of Medicine, told NBC Today. I think what we're seeing here is a drift where some of the mutations that the original Omicron had are gone and others have been added. Those mutations could be worrisome if they turn out to affect any of 3 key areas: disease transmission, severity of disease, and the variant's ability to evade immunity, Dr. Albert Ko, Raj and Indra Nui, professor of public health at the Yale School of Public Health, said. Early evidence suggests that BA.2 is more transmissible than BA.1, he said, but whether or not it affects severity or immunity evasion is still being evaluated. This is, of course, evolving information where we're all just learning about this right now, Ko said. The variant was first identified in South Africa, in Denmark, and then in the United Kingdom, Ko said. Now, BA.2 has been detected in multiple states, NBC News reported, including New York, California, Texas, Wisconsin, and others. And experts say it's likely to spread widely in the country. How transmissible is the BA.2 variant? Early data suggest that BA.2 is more transmissible than previous variants, and even more transmissible than Omicron.
California tops 80,000 COVID deaths as virus cases tumble.
Los Angeles County on Thursday reported more than 100 new COVID-19 deaths, the highest daily number of deaths since last March. Los Angeles, coronavirus deaths in California have topped 80,000 and another 3,000 people are projected to die by month's end, even as infections, hospitalizations, and intensive care cases are falling almost as fast as they climbed during the rapid-fire Omicron wave of the pandemic. The toll reached 80,688 on Friday, according to data collected by Johns Hopkins University. That is the highest in the U.S., but the nation's most populous state has a per capita death rate that is among the lowest at 38. Texas has only a few hundred fewer deaths than California but has 10 million fewer residents and therefore a higher per capita rate. This milestone is a grim reminder of the real human toll of this pandemic, said state epidemiologist Dr. Erica Pan, who urged Californians to get vaccinated and boosted. Another 220 deaths in California were reported Thursday, and the state's forecasting models show the death toll topping 83,600 by the end of February. Despite the grim tally, other indicators showed California is clearly past the peak of the latest and most infectious wave. The state's hospitalizations have fallen by more than 3,300 from their peak of 15,435 2 weeks ago, which was well below the all-time high of nearly 22,000 in January 2021. There were fewer than 2,300 intensive care patients, down 300 cases from 10 days ago and less than half the January 2021 number. We've definitely passed the peak and we are seeing a downward trend in the numbers, but we are not out of the woods yet, Sacramento County Health Officer Dr. Olivia Casirai said.
Florida adds 132,622 COVID cases, 1,324 deaths in past week.
132,622, number of new cases in Florida. 18,900, average cases a day, a 33.3% drop compared to previous week. 5,610,370, total number of cases in Florida. 1,324, number of new deaths, an 11% increase compared to previous week. 66,279, total pandemic deaths in Florida. Vaccinations. 59,972, vaccines, first or second doses, administered last week, down 17% from previous week. 73%, Florida residents 5 and up who are at least partially vaccinated. 70%, total Florida population that is at least partially vaccinated. 80%, U.S. residents 5 and up who are at least partially vaccinated. 76%, total U.S. population that is at least partially vaccinated. 45,290, booster doses administered in Florida in the last week, a 37% drop compared to previous week. 22%, total Florida population that is boosted. 27%, total U.S. population that is boosted. Positivity. 18%, Florida, compared to the previous week's 23.5% rate. 31.2%, Clay. 26%, Hernando. 21.6%, Pasco. 20.7%, Polk. 20%, Manatee. 19.4%, Hillsborough. 18%, Pinellas. Hospitalizations. 7,744. Florida hospitalizations, a 17.7% drop compared to the previous week. 2,789. Tampa Bay admissions, a 10.6% drop from the previous week. Local cases. 29,619. New cases in Tampa Bay, a 31% drop compared to the previous week. 1,020,752. Total cases in Tampa Bay to date. 286. New deaths in Tampa Bay, a 188.9% increase compared to the previous week.
Region records 64 more COVID-19 deaths, as virus spread steadily declines, data shows.
A total of 64 more people died from COVID-19 in Northwest Indiana in a one-week period, according to data from the Indiana Department of Health. Statistics updated Friday showed that there have been a total of 1,621 coronavirus-attributed deaths in Lake County, 499 in Porter County, 327 in LaPorte County, 63 in Newton County, and 128 in Jasper County. Last Friday, Lake County reported 1,580 deaths, meaning an additional 41 people have died of the virus in the county in a 7-day period, statistics show. In a one-week period, Porter County reported 6 new deaths, LaPorte County had 8 more, Newton County had 1 more and Jasper County had 8 more. In total, COVID-19 has killed a total of 20,894 Hoosiers since the start of the pandemic, indicating an additional 386 deaths statewide in the last 7 days, Friday data showed. State health records show a total of 2,441 Hoosiers were hospitalized with COVID-19 as of Friday, according to the Indiana Department of Health. Currently 28.7% of ICU beds are in use by coronavirus patients with only 13.3% of ICU beds in the state available.
Hawaii records 18 new coronavirus-related deaths, 1,278 additional infections.
Hawaii Department of Health officials today reported 18 new coronavirus-related deaths and 1,278 new confirmed and probable infections statewide, bringing the state's totals since the start of the pandemic to 1,222 fatalities and 225,535 cases. 12 of the latest deaths were recorded on Oahu, with Hawaii Island and Maui reporting 3 fatalities each. No further information was immediately available regarding the latest deaths. The state's official coronavirus-related death toll includes 902 fatalities on Oahu, 167 on Hawaii Island, 116 on Maui, 22 on Kauai, 3 on Molokai, and 12 Hawaii residents who died outside the state. Hawaii Department of Health investigators find out the vaccination status of each positive case after the fact, which is why those statistics are not included side by side in the daily case counts, officials have previously said. The U.S. coronavirus-related death toll today is over 900,000 and the nationwide infection tally is more than 76.3 million. Today's new confirmed and probable infection count includes 750 new cases on Oahu, 192 on Hawaii Island, 129 on Maui, 135 on Kauai, 5 on Molokai, 5 on Lanai, and 62 Hawaii residents diagnosed outside the state. State health officials have been including probable infections in its total case counts. Probable infections include people who never received a confirmatory test but are believed to have had the virus because of their known exposure and symptoms or because of a positive antigen test. The daily infection tally is usually from cases reported to the state 2 days earlier. The total number of confirmed and probable coronavirus cases by island since the start of the outbreak are 157,456 on Oahu, 24,263 on Hawaii Island, 26,759 on Maui, 10,341 on Kauai, 886 on Molokai, and 570 on Lanai. There are also 5,260 Hawaii residents who were diagnosed outside of the state.
What treatments are approved for COVID-19, and how do I get them?
As the COVID-19 pandemic has worn on and researchers learn more about the disease, treatment options available to those with the virus have expanded. Although current COVID-19 treatments are for people who are at a higher risk of complications from the novel coronavirus, including older adults, they are still in short supply across the state. Here's what you need to know. What treatments are available? Currently 4 treatments have been granted an emergency authorization from the Food and Drug Administration that are available in Texas, according to the state health department. Monoclonal antibody treatments. One of the treatments is a monoclonal antibody, a laboratory-made protein that mimics the immune system's ability to fight diseases and is given to patients intravenously. Sotrovimab, made by the company GlaxoSmithKline, is used for those 12 and older who are at a high risk of getting seriously ill with COVID-19. 2 other monoclonal antibody treatments, bamlanivimab and etesevimab, made by the company Eli Lilly, and Regencov, or casirivimab and imdevimab, made by the company Regeneron, are no longer authorized for use against COVID-19 because they do not fight the Omicron variant of the virus, the FDA said last month. Long-acting antibody treatments. Another treatment, AstraZeneca's Evusheld, is known as a long-acting antibody product. Evusheld is authorized for people 12 and older who have moderate to severely compromised immune systems and people who have a history of severe allergic reactions to COVID-19 vaccines or components of them. The treatment is given as 2 injections and may provide protection against COVID-19 for up to 6 months, according to the FDA. Oral medications. 2 oral medications against the virus have also been authorized by the FDA, molnupiravir, or Merck, and Paxlovid, made by Pfizer. The Merck medication is taken as 4 pills every 12 hours for 5 days. Paxlovid is taken as 3 pills a day, twice a day, for 5 days.
A different COVID-19 vaccine debate. Do we need new ones?
COVID-19 vaccines are saving an untold number of lives, but they can't stop the chaos when a hugely contagious new mutant bursts on the scene, leading people to wonder, will we need boosters every few months? A new vaccine recipe. A new type of shot altogether. That's far from settled, but with the shots still doing their main job, many experts are cautioning against setting too high a bar. We need collectively to be rethinking what is the goal of vaccination, said Dr. Daniel Kuritskas, infectious disease chief at Brigham and Women's Hospital. It's unrealistic to believe that any kind of vaccination is going to protect people from infection, from mild symptomatic disease, forever. If the goal is preventing serious illness, we may not need to be doing as much fine-tuning of the vaccines every time a new variant comes. The virus is essentially shape-shifting as it mutates, with no way to know how bad the next variant will be. A technician inspects filled vials of the Pfizer-BioNTech COVID-19 vaccine at the company's facility in Puurs, Belgium in March 2021. Pfizer via AP, already a substrain of Omicron bearing its own unique mutations, is circulating. Research is underway to create next-generation vaccines that might offer broader protection against future mutants, but they won't be ready anytime soon. The immediate solution, getting today's shots into more arms, will reduce the opportunities for the virus to mutate and spawn new Greek letters that we then have to worry about, said Jennifer Nuzzo of the Johns Hopkins Center for Health Security.
Optimism rises as LI COVID-19 infection rate continues to fall.
As the percentage of Long Islanders testing positive for the coronavirus continues to decline, numbers could within the next few weeks fall to levels from last April and May, infectious disease experts said on Saturday. Positivity rates had dropped below 2% by late April and to under 1% 3 weeks later. Barring the emergence of a new variant or anything else that we just don't fully understand about the virus, I am very optimistic that at least in the short term we could have very low rates, said Dr. David Hirschwerk, medical director of North Shore University Hospital in Manhasset. Long Island's 7-day rate of positive coronavirus test results dropped on Friday to 5.49%, the lowest level since November 30th, according to State Department of Health data. Daily positivity rate. Nassau, 4.1%, Suffolk, 4.9%, statewide, 3.76%, 7-day positivity rate. Nassau, 5.3%, Suffolk, 5.7%, statewide, 4.87%, source, New York State Department of Health. The highly contagious Omicron variant, which was first detected in New York in early December and then spread rapidly, caused cases and positivity rates to soar, with the positivity rate on the island reaching nearly 27% just a month ago. Dr. Leonard Kriliff, an infectious disease specialist and chief of pediatrics at NYU Langone Hospital Long Island in Mineola, said that unless there's a new variant or another unexpected factor, rates likely will continue to decline more rapidly this year than they did last winter.
COVID-19 around the world. Why should you care?